Good, Chris? Okay. Good afternoon, everyone. I'm joined by Minister Dix here on the traditional territory of the Lekwungen-speaking people, the Esquimalt and Songhees First Nation. We've just completed our weekly cabinet meeting, and I wanted to update British Columbians on some of the initiatives that we were discussing today. Firstly, of course, the state of emergency has been extended for an additional 2 weeks. As we turn the dial up and increase our social and economic activity, it's important to make sure that we don't lose sight of the objectives that we as a province collectively embarked upon some 2 months ago. In fact, it was 10 weeks ago that we announced the first public state of emergency, and adding 2 additional weeks makes this the longest period in BC's history where emergency orders have been in place. People will remember back to 2017, the horrific fire season that year led to 10 weeks of emergency status in the province, and we are now exceeding that with, I have to say, no likely end in sight. We've been making progress. Minister Dix and Dr. Henry advise us daily of that progress, and I'm excited about the future, but we also have to recognize that we don't want to give up the ground that we have made collectively and as individuals. I also want to announce that although MLAs, members of the legislature, have been working throughout BC in every corner of the province, there is an expectation that members of the legislature will be here in Victoria, in this building, conducting the democracy that we are so fond of and is so foundational to who we are. So the 3 parties have been working with the legislative clerk, and we have found an agreement where safe resumption of the legislature can take place. Effective June 22nd, MLAs will be returning to Victoria so we can conduct the business of the province. Some will be here in person, some will be beaming in with technology, but at the end of the day, debate will take place, votes will be cast, and democracy will be well served. I think that as we look at other jurisdictions who have continued with their legislative processes, we have seen similar attempts to try and find a way to mix in-person activity with technology and ensuring that physical distancing can take place. And those members of the legislature who are vulnerable, maybe with illnesses that do not put them in a position where they want to mix with other members of the community, I think we can find accommodations. In fact, we have found accommodations, and I'm excited to get back to work. But before that happens, I want to acknowledge and thank members of the legislature from all political parties for the focus that we have all had on ensuring that British Columbians were at the front of our agenda. Partisanship has left the building, and it may well be returning in June, but I do want to say today that I'm grateful to the work of the BC Liberal Party, the BC Green Party, and my colleagues in the NDP for taking this challenge on, not as partisans, but as people, focusing on the needs of British Columbians, and it's been a success for all of us, and although I'd like to continue it on as long as possible, I'll understand if a partisan rock or two are thrown in the weeks ahead. Today, we're also going to announce Minister Dix and I were prepared to make this announcement, I think it was the week of the pandemic arriving in British Columbia. We were going to talk about the need for providing more health services in communities across BC, and in particularly, we were going to talk about the need for more healthcare professionals and what we have characterized as the expansion of the primary care network in British Columbia. Minister Dix has been working on this since he was sworn in as minister. There's a challenge in every part of BC finding a family doctor. As communities start to grow, finding family physicians have been difficult. So we have brought in an innovation to the system here called urgent primary care centers that are supported by urgent primary care networks. And for too many people, the struggle to find a family doctor has now been relieved because of these community endeavors. And today, we're proud to announce that although it would have been opening soon if we'd announced it at the start, opened yesterday a new urgent primary care center, the second one in the city of Surrey, the 17th in British Columbia. The Surrey operation that we opened in November of 2018 has already seen over 29,000 patients. And that's extraordinary. Those are 29,000 patients that did not clog the emergency room at Surrey Memorial Hospital. And we're going to continue, of course, with our plans to develop a second hospital in Surrey, centered in Cloverdale, which will put all of the healthcare needs, acute care, urgent primary care, as well as expanding and developing culturally sensitive and appropriate care for seniors in that great community of Surrey. And then we're going to be building this across the province as well. 90,000 people in Surrey don't have a family doctor. The urgent primary care centre we're announcing today will alleviate a great deal of the pressure on those families. I want to thank Minister Dix for his focus on this issue. Despite the extraordinary challenges that we've had on the public health side, we are also remaining vigilant and focusing on the delivery of regular services for the people of British Columbia. The Fraser Health Authority as well has done extraordinary work to prepare the ground for this second urgent primary care centre in Surrey, as well as getting into the planning stages, the business planning stages for the second hospital. So I'm happy to take any questions you may have on the issues that I've raised here today or any others that are on your mind. Minister Dix is here for any of the focused questions you may have on public health or on the announcement we're making today about the second urgent primary care centre in Surrey.
A reminder to reporters on the line, please press *1 to queue for a question and unmute your phones. You won't be audible till I call your name. We're going to start today with a question from Tom Zaterik from Surrey Now Leader.
Hello, hello, Premier. How are you doing?
Good. How are you doing?
Hello.
Hi.
Hi. How are you?
Good.
Good. Good. Whereabouts is the urgent primary care centre going to be in Surrey?
It's going to be in Newton, I think. King George and
6830 King George Boulevard.
6837 King George Boulevard.
6830.
6830
Yeah.
King George Boulevard. That's Newton. Yeah.
That was it.
It's going to be open initially for 44 hours in the week, and by the end of July, we're hoping that it will be 7 days a week, 12 hours a day. And this is going to greatly relieve the pressure, again, increasing pressure on Surrey Memorial, and provide this alternative approach to healthcare for the people of Surrey. I know in my community of Langford, the urgent primary care centre there has greatly relieved the pressure on the Victoria General Hospital and given the people in my community a sense of comfort that they can access care even though they don't have a specific family doctor. And it's not always a doctor, of course, you need. The urgent primary care centres will have nurse practitioners, will have RPNs, will have a whole host of other healthcare providers, dietitians, social workers, and a network behind those that are on the front lines to make sure people get the services that they need.
Our next question is from Lisa Yuzda. Go ahead, Lisa.
Thank you, Premier. Looking at the horrors that were discovered in long-term care homes recently in Ontario and before that in Quebec, many families here in BC very frightened about what's happening behind the walls in care homes where their parents and grandparents are. They're, of course, cut off because of restrictions of COVID-19. And so they can't be there to ensure that they're getting the care that they've ensured prior to now. So can you be specific about what is being done in the province of BC to ensure standard of care is being maintained while families are not in there to ensure that their loved ones are getting the care they want them to receive?
Well, thank you for the question, and I was horrified in Ontario about the challenges in the long-term care facilities in those two provinces. And when we were sworn in as a government back in 2017, we took to heart the work of the seniors advocate who had put a pretty exhaustive report in place talking about long-term care facilities and the inadequate staffing in those facilities to meet the basic number of hours required to meet provincial standards. So the previous administration put in place standards and then proceeded to not meet them. So Minister Dix was tasked with improving the ratio of time per patient, and we were fairly successful at that with more work to do. Adrian can talk about some of the details around that, but our focus was making sure that our elders, our seniors, got the dignified care that they deserve in the last years of their lives. As we go into the pandemic, we've discovered, of course, also that there was insufficient compensation for some care workers who were finding themselves working at 1, 2, and sometimes 3 facilities. So very early on in the piece, Minister Dix and Dr. Henry took action to restrict that, to ensure that we were not having transmission from one facility to another when it comes to COVID-19. On the broader question of public confidence within our long-term care facilities, I can say with great certainty that the providers are giving the best care possible under extraordinarily difficult circumstances, and the horror stories that we're seeing out of Quebec and Ontario are not being duplicated here in British Columbia. I don't want to even want to add something to that.
Thank you, Premier. Just to make a few points, as the Premier has said, that when in 2017, and this has been supported across the political spectrum, there were 95 care homes in British Columbia under what's called 2.9 hours per resident day. There are 0 now. The government introduced Bill 47, which got rid of Bills 29 and 94, which drove a system where workers in healthcare had less rights than in other areas, and that was supported unanimously in the legislature. We've added healthcare assistance seats, which is critical because there are human resource questions in healthcare. We've started programs including a new dementia village, which we've launched in Comox. Since COVID-19, and I think just join the Premier in expressing our extraordinary appreciation to all those people working in healthcare, working in care homes, and working in the health authorities who've brought in measures to deal with the terrible effects COVID-19 can have on care homes. It's true that in care homes and in assisted living homes, 4,000 to 5,000 people have died in Ontario and Quebec. That number is still unacceptably high in British Columbia. It's 92, but it's still unacceptably high. And the measures taken to ensure that all care homes have access to PPE, not just health authority owned and operated care homes, which was very important, restricting visits in long-term care, the work of infection control practitioners who were brought in, the rapid response teams that were brought in, and of course the single site order, which has been implemented now in 499 out of 545 eligible homes. So all of those measures are taken. This is the direction we received from 2017 from the Premier, and certainly now, and I want to praise Dr. Henry and all those involved on the ground who have made this happen. Are care homes in British Columbia perfect? Absolutely not. We have to continue to make improvements. But I'm very proud of the work our teams have done, and very sorry for all those as well whose family members have died before they should as a result of COVID-19.
Our next question is from John Hernandez.
Hi, Premier. Canucks GM Jim Benning is now saying that the Canucks are considering holding a training camp out potentially in the United States because of the 14-day quarantine rules in BC. What's your general reaction to that? They seem to be losing confidence over this hub city approach, something that you've been in favor of. What are your general thoughts on that? And if maybe Dix can weigh in French for us on that as well.
Okay. Fair enough. Yeah, thanks, John, for the question. First of all, I'm excited that the Canucks are in the playoffs. That's the good news. I've spoken with the NHL. I've spoken with, we've been in touch with the NHL Players Association on the hub city concept. The NHL has continued to have Vancouver on the list of potential sites for all of the reasons that we laid out for the officials at the NHL and the NHLPA. Minister Lisa Bear has been working with the Canucks, focusing on how we can get hockey back into the arena in downtown Vancouver and get hockey on the television screens of all of those fans across BC, across the country, and indeed around the world. But we will not waive the rules that are actually the rules of Canada, which is you require a 14-day isolation period when you're coming into the country. We fought very hard, Minister Dix and I, to make sure that those rules were being enforced, not just in BC, but indeed across the country. And although, as I understand it, the NHL is looking at resuming play in the middle of July, in COVID years, that's 1,000 years from now. And I look forward to continuing my discussions with the Canucks, with the NHL, about how Vancouver and British Columbia can play a part in the restart of the NHL. But we're focusing on the well-being of the citizens of British Columbia, as we should. And if we can do that and continue to focus on trying to bring hockey back to Vancouver, we'll do so. But the rules are in place. They're national rules that we fought hard to have put in place. I'm not going to ask for those to be bent today on the prospect of games potentially being played 8 weeks from now.
Our next question is from Binder Sajan. Our next question is from Binder Sajan. Go ahead, Binder.
Hi, Premier. Just wanted to ask you with regards to your government's focus on supporting women. You've got a parliamentary secretary. You've talked many a time about all the things, the priority that this is and gender equity is for your government, and yet a report card out today is saying it's not giving you very good grades. And I'm just wondering how you respond to that, especially in a time during a pandemic when we've seen that women and vulnerable people seem to be most at risk.
I'm not, I apologize, Binder, I'm not familiar with the report you're referring to. I'm very proud of the work that we've done on gender equity here in British Columbia. I'm very proud to say that I'm the only leader in the country that half of my colleagues are men and half of my colleagues are women, not just in my cabinet, but in my caucus. We as a political party have worked very hard to ensure that the gender diversity, the ethnic diversity, the sexual orientation diversity in the broader community is reflected in our public institutions, and we're going to continue to do that. Just yesterday, Parliamentary Secretary Mitzi Dean announced a $10 million fund to protect vulnerable people, mostly women and children fleeing domestic violence and sexualized violence. I'm proud of that, and there's more work to do. So I'm not familiar with who issued the report, and I'm not familiar with the findings, but I'm proud of our progress to date, and of course there's always more work to do, and we don't shy away from that, but I don't know what numbers you're talking about.
Our next question is from Vaughn Palmer.
Good day, Premier. This 14-day isolation rule, self-isolation rule that's raised some questions about the NHL. Are you concerned that that rule could also be an obstacle to reopening the film and television sector in British Columbia, where production companies might choose to locate in, say, American states where there's no 14-day rule as an obstacle to getting started to work?
Well, thanks, Vaughn, for the question. We have been focused on the film and television sector. Again, Minister Lisa Baer is responsible for that file, and we have a proud history here in British Columbia going back at least 25 years in my experience, maybe 30, of encouraging the development of Hollywood North. And we're widely regarded as I think the third largest film production center in North America after Los Angeles and New York. And we're in a place where we have a skilled workforce, we have studio space, we have post-production capacity now, a whole host of services to offer the film and television industry. And the self-isolation period, again, if you have to spend 2 weeks in isolation, Vancouver is not a bad place to do it. Vancouver Island is not a bad place to do it. And those rules are in place today at our urging, and we will ask for them to be relieved or to be diminished at a time when we believe it's safe to do so. We're going to take advice from Dr. Henry and Minister Dix and public health officials on how we're doing and keeping these numbers down. They've been very positive, as you know, over the past number of days, but we need a couple of periods of incubation periods to be confident, and then we'll maybe take a look at it then. But I know Minister Baer's in contact. We're working with Prem Gill at Creative BC and trying to make sure that production companies and those that are in the business of making films for television and the big screen understand and recognize BC is preparing for a return to an active schedule as soon as we possibly can.
Our next question is from Farhan Lalji.
Premier Horgan, thanks for taking my question. Just on the subject of the Canadian Football League and the BC Lions, I know that there's been some suggestion based on an ask to federal government for support a few weeks ago that ultimately an ask may involve the provinces as well. What's your thought on potentially providing some support, financial or otherwise, for that franchise?
Well, there's no shortage, Farhan, of requests from every sector for assistance at this very challenging time for all of us. I'm an enormous CFL fan, a big backer of the BC Lions. I've been in contact, or they've been in contact with me since the advent of the pandemic and looking at what the season would look like. I know that they're looking at perhaps a later in the fall season of CFL play, and that'll, of course, depend on whether we believe that that's safe to proceed. Football, of course, involves a lot of people on both sides of the line, not just on the field, but on the sidelines. So those are issues that will need to be worked out. Dr. Henry's been pretty clear, and why I believe we've been having success, and I've said this in the past, is that rather than look for absolutes, we always look for solutions. And Dr. Henry's at the center of that, practically trying to find ways for activity to take place, not finding ways for activity to be shut down. But at the center of our activities is focusing on public health and wellness. We'll continue to do that. I'm always available to talk to the CFL, particularly the Lions and the CFL Players Association, about how I can be helpful. But there's been no formal requests at this time, but I'd love to see the Lions have a season this year. We were talking about getting in line to host the Grey Cup a couple of years down the road, and I'd like to get those discussions started as well.
Our next question is from Andrew McLeod.
Yeah, hi, Premier. The Union Unite here did some polling recently and found strong public support for requiring businesses that have laid off workers during the pandemic to rehire the same people they laid off before they open up those positions to other people. And they found support for that, especially if the businesses have received government aid during this time. I'm wondering what, if anything, your government may be doing to address that.
Well, I certainly support the initiative as you've outlined it, Andrew. I believe that businesses should be looking at their employees, their previous employees, as they start to contemplate when it's appropriate for them to restart. As gradually we look at stage 2 and then moving into stage 3 of the restart here in British Columbia. I'm always available to talk to Unite here and other organized labor as well as businesses about how we can get people back to work, how we can get to a place where we were not that many months ago, where we had 4.5% unemployment, a balanced budget, and capital programs that were, again, leading the country. I believe we will get there again, but the challenge, of course, is we need to do it together. That means labor, business, social organizations, civil society, broadly speaking, has to continue to have the focus we've had for the past 2 months. And again, anyone I talk to, the first thing they say is, how can I help? And of course, I direct them to the directives of Dr. Henry: wash your hands, keep a physical distance, do not come to work when you're sick. Everyone can do that, and everyone can contribute if they follow those 3 simple rules. But on the broader question of how do we restart the economy, getting people back to work in traditional businesses, I'm counting on businesses that were successful with their workforce to look to that workforce to return as quickly as possible, provided it's safe to do so.
Our next question is from Dirk Meissner.
A few minutes ago, you said July is a long time away with regards to playoff hockey. I'm just wondering if you could look and consider that by July, perhaps the 14-day quarantine restriction would not be in place.
Well, that was my inference, Dirk. What I meant to say is that during the past 10 weeks, every day seems like 7 days. I call it COVID years are like days are like dog years. We are doing a whole bunch of stuff in a short period of time, and every day brings new challenges. Every day brings new opportunities. We have rules in place today that we worked very hard to establish, and because the NHL made an announcement that involved Vancouver, we're not going to go rushing to change that. 2 weeks from now, 4 weeks from now, could be a completely different situation, provided we continue to see the progress that we've seen here in British Columbia, which involves everybody working together, observing physical distancing, keeping your hands clean, and doing those basic things that now seem so basic and fundamental to our well-being, as Dr. Henry has prescribed. But I don't want to rule out the NHL coming here. They haven't presented a plan to us. And when they do, in fact, when I talked to Commissioner Bettman, I said that Dr. Henry was enthusiastic about looking at a plan, and we haven't seen one yet. So we'll take the days as they come, today. There's a 14-day self-isolation period in place, and I expect that will be there for the foreseeable future.
Next, we have a question from Tom Fletcher.
Hi, Premier. Thank you. On travel restrictions and tourism generally, the Canadian American Business Council has a new project called North American Rebound to begin economic recovery. And Dr. Henry has been considering a gradual easing of U.S. travel for family reunions as well as essential trade and business. For BC tourism, however, that's the hardest hit sector, it seems. Destination BC is advising its business clients that they expect no non-essential international travel for the rest of the year based on earlier statements from you. Is that still your expectation, specifically for the U.S., or is there some room to move now? And have you by any chance had a chance to speak to Governor Inslee about this?
I haven't talked to Jay Inslee in a while. It's been, again, in COVID years, it seems like a long, long time. It might have just been last week, Tom, but I just don't know. But it's been a while. And my view is that we have made progress in British Columbia because we have insisted on our borders being closed, and anyone who's coming into Canada, for whether they be British Columbians returning home from abroad, are required to self-isolate for 14 days, and we've been tracking that. 32,000 tracking endeavors have been undertaken by British Columbia to protect our borders as part of the program we put in place with the federal government. So there's been a lot of activity making sure that people are living by their word and they're living within the plan that they gave to us when they arrived in the country. On the whole question of international travel, we're going to review that as we do with all issues on a weekly basis. I don't foresee any change in the near term at all, and that's why we're asking Destination BC to focus on encouraging British Columbians to stay home and go to those places they haven't been to in a while or perhaps have never been to. If you haven't been to Barkerville, it's a good idea, and Quesnel would love to see you on the way. Going to the interior and enjoying cherry season is something I would very much like to do. There's a whole bunch of things that we can do right here in British Columbia. 42,000 people booked campsites on Monday. So there's a lot of British Columbians who have things to do in BC that can stimulate our tourism economy. And I think that's where I'd like to focus, Tom, is on encouraging people to get out and see something, hopefully in your neighborhood. But if you want to travel further afield as the situation changes over the summer, I think that's good for everybody. It's good for the tourism economy, and it's good for British Columbians to recognize that there's no bad place in BC, just splendor as far as the eye can see, for all occasions, as it says on the logo.
Our next question is from Richard Zisman.
Premier, one of the things when you were announcing the rollout of a return to school was an expectation that it may take some time for parents to get their kids back into the classroom. We're now getting a sense from districts that it's going to be around 50% of all kids returning to school. Does that surprise you that it's that high, and are there any concerns about that many kids going back into the school system all at once?
No, would not have given approval to the plan if they felt that anyone was going to be at risk, whether it be support staff, superintendent, administrators, teachers, kids. So we're comfortable with the plan that Minister Fleming has put in place, and that plan was developed by CUPE, BC Teachers Federation, Vice Principals and Principals Association, trustees, and local communities, so as well as Parent Advisory Council. So all of the stakeholders in the K-12 system, and they are numerous, and they oftentimes are on different pages, have all come together to put in place a plan that we believe will work for the month of June to better prepare us for the return to regular school in September. What will happen on Monday will happen on Monday, and I'm sure that on Wednesday you'll have questions for me. But I'm very comfortable that all of the players in the system are on the same page. That's fantastic news for our system, fantastic news for our kids.
Our next question is from Samir Kaushal.
Hi, Premier. Thank you so much for taking my question. And I'm sorry, I joined late, so maybe you have answered this question already. But when can we expect the third phase of BC's Restart plan, especially some ease in restrictions for event planners and wedding businesses?
Well, we are just in the second week of phase 2, and we're looking at what progress we make. And again, British Columbians are deciding how comfortable they are in the marketplace, how comfortable people are to go into businesses, to go back to work, all of those issues. So we need to see how phase 2 goes before we start contemplating phase 3. So far, so good. Again, Dr. Henry and Minister Dix review the data regularly, and we'll get advice from them, and that will go to cabinet and we'll make a decision. But our focus is on public health, making sure people are safe. We want to get the economy back to a place where people can be comfortable going to work, going to shop, going to visit destinations around British Columbia. But we're not certainly at stage 3 yet. We're expecting that to be sometime in later into the middle of June. Eh? We'll see how it goes, but we don't expect to be having any detailed discussions about that until at least the middle of June.
Next, we have a question from Mary Brooke.
Hi, Premier. Given the outcome of the extradition court case today in Vancouver for Meng Wanzhou, do you see any PPP procurement problems for BC or for the federal procurement system as part of the expected Chinese government pushback? And as part of that, how is BC's overall progress with producing PPE and manufacturing ventilators coming along here at home?
Well, I'll ask Adrian to answer the questions about the PPE supply, because that's something that he's focused on every day. But on the case in Vancouver today, I haven't read the ruling. I understand I've been briefed on it. The decision of the courts is the decision of the courts. Where we go from here, what appeals take place, what happens next is entirely up to the various participants. For my part, I'm going to continue to conduct the business of BC to the best of my ability, to make sure that we have supplies that we need, to make sure that relationships that we need to have in place are in place. And I'm confident that the decision today in the courts may have ramifications across the country and around the world. But as far as I'm concerned, the case was heard in Vancouver. Ms. Meng is staying in Vancouver, but this was a decision by the national government. This is an issue that involves national issues with respect to extradition, with respect to other nations' states. That's not my file, and I'm going to stick to my own knitting and focus on the many and varied challenges I have here rather than look at others. And you want to add the PPE piece?
Well, just to say, because of really extraordinary efforts here in BC, we've worked hard to address what has been a massive disruption in international supply lines for PPE. I'll just give you an example. Since the beginning of April, we've obtained 4 million N95 respirators, many of them from China and non-traditional sources. And we've gone through the process as you'd expect, because we want materials to be safe for people, to test that material. We've also obtained just this week and are putting into service a testing machine to help speed up that process. So we've been doing that work, and I think the work that public servants have done and British Columbians have done has really been extraordinary. We've had some help from the federal government. They've had some challenges too. We've received, I think, in the neighborhood of 60,000 of those 4 million respirators from federal suppliers. But our people, as you can see from those numbers, have been quite effective, and we're just going to continue to do the work, working to ensure excellent supplies of PPE, because we're going to need that in the months to come.
We only have time for one more question, and it's going to Sean Eckford.
Thank you. Mr. Premier, yesterday I was following the Commons Finance Committee and some testimony from the Canadian Ferry Association and the Urban Transit Association about federal support. And one of the things that was said is if BC Ferries continues to face revenue shortfalls like it is, it'll have a negative effect on the recovery in ferry-dependent communities. When I asked you about a month ago, you said you were pretty optimistic about talks with the federal government on support for public transit and ferries. Sounded yesterday like there's not much cause for optimism, but do you still see that going forward well?
I do, and we had success in continuing to press for a national plan to deal with sick pay so that we don't have people going into work sick. And now that's at the formative stages, of course, but we were persistent week after week, raising the issue, building a consensus around the Premier's table, building the ask for the federal government to get involved. And we've now made some progress. I know that on municipalities, broadly speaking, and that's where, put aside BC ferries for a moment, that's where the challenge rests for our public transit systems in major urban centers, whether it be BC Transit in smaller communities like Victoria, Kelowna, Kamloops, or TransLink in the Lower Mainland. And so I've made my case again repeatedly to not just the federal government, to my colleagues across the country. And I know that Premier Ford in Ontario, with all the myriad and sundry challenges that they have there, are also critically aware of the decline in ridership on their very elaborate public transportation system and the impact that's going to have on the private sector economy, and it's going to have the impact, of course, on people who will not be able to get to work when they're prepared to get back to work as the Ontario economy opens up. So having an ally like Premier Ford to help me push the federal government on these questions has been greatly appreciated by me, and I believe we're making progress. On the ferry front, that's a bigger challenge, and of course, although we are the largest maritime province in terms of the ferry system that we have in place, the Maritimes have publicly funded transportation systems similar to ours as well, much smaller scale, of course. And so I try to build allies across the country when I make these appeals to the federal government. We found allies when it came to the borders. We're finding allies when it comes to municipalities. And of course, we're finding allies every day when it comes to sick pay. And my approach to this process, when Minister Dix and Dr. Henry and I announced the pandemic plan way back on March 5th was, and we all agreed, how do we find a way to ensure that we're maximizing the impact that we have here in British Columbia by ensuring that other orders of government are working with us. So Selena Robinson has been tireless in reaching out to local governments here in British Columbia to try and make sure that when there are issues, when there are concerns, we work on them collaboratively. And similarly, Minister Dix sits at a table with health officials across the country. Minister James sits at tables with finance officials across the country. And British Columbia has been driving the agenda in many cases because we thought about what we need to ask. We put the work in before we get there, and then we start to build relationships. So we'll see where we go on transit. Ferries is another challenge for another day, I think.
Thank you, everyone. That's all the time we have.
Okay. See ya.